Now to new fears that progress in the fight against coronavirus may be stalling. That's because at the same time more Americans are getting vaccinated, public health officials are seeing another worrying trend. Here's CBS's Meg Oliver.
Tonight, there's concern as COVID cases rise in nearly half the country. And for the first time in weeks, the CDC's National Ensemble forecast is predicting deaths will not decline.
When you're at that level, I don't think you can declare victory and say you've turned the corner. You've got to continue to do what we're doing.
New studies showed that fully vaccinated people can get COVID, but it's extremely rare. One study found that only 7 fully vaccinated healthcare workers out of 15,000 in Los Angeles and San Diego tested positive for COVID.
That's where we want to be. When, as a country, we are at that level, we will have turned the corner.
Today, 12 state attorneys general called on social media giants to block online vaccine conspiracy theories, targeting people of color and Black Americans, specifically members of communities who have suffered the worst health impacts of the virus. Those communities also suffering the worst inequities in education.
We still have work to do, lots of work to do. You know, we know there are inequities to in-person learning.
New data release shows just over a quarter of white students are learning online, compared to nearly 60% of Black and brown students that are learning remotely.
It is no surprise.
Elma Roldan works with low-income schools in Los Angeles.
Do you think this will initiate any real lasting change?
I sure hope so. There's a real conversation today about, one, how much more we need to invest in our youth, and our young people, but also the equity in how we distribute those dollars to support kids who have already lost so much.
Here in New York City, the mayor announced today he will use federal pandemic recovery funds to make preschool free for 3-year-olds beginning in the fall. Families who enroll are expected to save $10,000 in child care costs. Margaret?
Meg Oliver, thank you.